in favor?
Aye.
All right, we are back in open session. All right, is there a motion to appoint Benjamin Reister, Josh Stonsky, Autumn Wardle, Jake Nelson, and Ethan Cordova as firefighter paramedics with the Wausau Fire Department?
Second.
Any discussion? All those in favor?
Aye.
Aye. Congratulations.
Welcome to Wausau Fire. Congratulations.
Congratulations. Welcome. Congratulations.
Congratulations, good luck. Congratulations, good luck. Thank you.
Missing one. You must have left. Oh, oh. Well, then that's good reason. Yeah.
All right. Moving on the agenda, there are no general agenda items, so we move to monthly presentations. So the monthly presentation of the fire department operations, which will include a monthly report and hiring update with Chief Bartek. Good morning, Chief.
Good morning. First off, is there any specific questions about the report? I know we're having a long meeting here. I'll cruise through that.
Just with the run data, can you guys add like just a paragraph about, this is typical, or, it's higher than normal? I mean, it's just
Sure.
data with no context.
Sure.
Yeah.
So maybe we could put a historical reference in there of some sorts, maybe a chart to say where we were that month in the last 5 years or something
Or
like
just,
that.
a couple comments about,
Sure.
is it abnormal, is it normal, is it?
Yeah, we can definitely add that. What we're seeing, and I can comment to that, we're seeing an overall, as we predicted, an increase in our call volume.
Mm-hmm.
I don't know if we're going to be near 7,000, but we're definitely going to be probably between, what we did last year and 7,000. I expect maybe somewhere in the range of 6,800 calls this year, which is about 300 ahead of where we were. Each month, it seems we've set records. June was probably our busiest month of the department's history. I can't say I specifically know how we sat in September, but I can definitely add that. So we're seeing that general upward trend, and we continue to expect to see that. It's just a gradual curve that continues to rise as this community continues to access us more and more for emergency services. So that's something that we predicted and we're preparing for, obviously, with the hiring. Any other questions about the?
Do you have a lot of drug overdoses, et cetera?
I don't know the specific data on that, and I'm sure Ben could comment to that too, because they're very well when we see the overdose deaths and stuff like that. That is unfortunately a common call for us. I can't specifically just speak to the how we're seeing that. I could ask the EMS division chief to write a paragraph about that in the next month's report.
Yeah.
Okay. All right, so thank you for interviewing these past 5 candidates. As you're aware, we're adding 12 to the department, so right now we need, in order to fill the positions that we had already open and the new positions, we need a total of 17 firefighter paramedics to serve the city. We've got a 2-phase plan. Phase 1 is occurring right now, and what you just interviewed was the candidates that have paramedic or are very close to completion of paramedic. In November, we've got 4 days of interviews scheduled. We'll go up and visit with HR. As of last week, Friday, we had 31 candidates that we're going to be interviewing over those dates. We will then bring you in the November meeting. The first 5 of those, we may ask the PFC to hold a special meeting maybe beginning in December to have another 5, and because we can only do 5 at a time, we'll still have a couple that we need to finish up maybe at the regular December meeting, which I think is being moved to December 19th potentially. So we're moving through those 2 phases. There's going to be some candidates that, as we're finding, that are going to be in the middle. They're not just an EMT basic, they're not paramedic, they're somewhere in their schooling. I think that's important for us to look at them as a quality candidate and then find ways to work with them as we move forward. All of the funding resources are in place. One of the other good news things that we have here is for continual funding for these 12 positions, additional positions. Right now, there's a state law, Act 225, which is known as the Ground Emergency Medical Transport Law. And what that's going to allow us to do once the federal funding conduit is placed and put in place is to increase our EMS revenues. So annually, we bill, in 2021, we billed $4.5 million for EMS transport. Our billing company, we contract a company called LifeQuest, who has a bunch of highly trained people that know how to bill Medicare, Medicaid, private insurance, things like that. They collected about $1.7 million, and when we were done paying them, we, the department, the city, took in about $1.5 million of that. 17% of our call volume is Medicaid patients. Now, the Medicaid, it pays extremely low. And so if we were to say, and this is just fictional numbers I'm going to throw out for an example, bill a patient $900 for a ambulance transport with some skills that were done, Medicaid may say, well, we're going to pay you $300 of that. This new act and then the federal funding source that's behind it will allow us to collect 50% of our unreimbursed expenses for Medicaid. So 17% of our call volume is Medicaid patients. We expect to see a very high number quite a bit of increase in our revenue through that funding source.
You're going to collect it from the patient?
That unreimbursed 50% actually comes from the federal government through a program that's being set up.
Because Medicaid, you're not able to do that.
Exactly. We can't, Medicaid's going to pay us what they're going to pay us, and unapologetically, they say that's all you're going to get. And so this new federal conduit that states are now becoming behind, Jeremy and I first learned about it at the Wisconsin State Fire Chiefs Conference last year from the Naperville Fire Chief, who was successfully implemented in their department. They're seeing revenues of over $1 million a year from that new source. So we're optimistic that this could become the part of the solution for the permanent funding of these additional 12 positions, in addition to the other plans that the finance director has already put into place. So a lot of behind the scenes work to not just recruit these candidates, but also to long-term be able to make them affordable to the community.
Are you going to need to add personnel to manage that program? I mean, if you're going to collect $1 million, it's worth it.
Well, I've long argued that we need another at least part-time administrative position. We've only got a singular administrative position inside our department, and that she's an unbelievably talented and gets an enormous amount of work done. We've been wanting to see some at least backup when she's off on vacation or leave, someone that can take over and assist her. We had approached, I think 2 years ago, Ben and I approached to do a part admin position between the PD and the fire department. And so I think that this federal conduit that I'm talking about for Medicaid reimbursements, I believe that we're probably going to be able to contract with our billing company to do the majority of the legwork on that. Would I prefer to do it in-house? Absolutely, but they're typically the experts on how to handle all these things. This is why we contract with them.
Yeah, I would recommend going out with the software, et cetera.
They're a very good company to work with. We've had a long-standing contract with them. So that's my updates for the month, unless there's any other specific questions. Oh, we did have another grant that I wanted to talk about. We just got $146,000 isn't a small amount of money, but when we're talking about the $3.1 million grant we just got, it seems small, but we were able to acquire an EMS Flex grant. I talk about it in my letter to the commission in the report. That is a ARPA dollars that the state received, and they are putting towards EMS agencies that are struggling in the state of Wisconsin. We wrote for the maximum amount, which was $305,000. They had an enormous amount of an enormous amount of departments around the state that applied for the grant. They originally only had $12 million in it. They had $63 or $64 million worth of requests. So they added another $20 million. And so the departments that received the grant are getting about 50% of that. That $146,000, we're going to be putting $100,000 towards a new ambulance. We're going to be putting $30,000 towards a new power loading cot system for that ambulance. And then the remainder will be used between equipment and training. So that's good news for us also. Great grant that's going to help us out. So any questions about report for the month? All right, thank you.
Good, thank you.
Thank you. Next up, the monthly presentation of the police department operations, which include the quarterly report and a recruitment and retention update from Chief Livin. Good morning, Chief.
Good morning. I have a quarterly report in your packet. I just wanted to talk about a little bit about recruitment and retention because that is a really important thing that we're working on right now. First, I'll talk a little bit about recruitment. We have an ongoing recruitment process. Actually, the application period closed yesterday. Captain Pauls was in Green Bay at a job fair, so hopefully she was able to get some more good candidates into the recruiting pool, and we're hoping to be able to bring those recruits to you in December to be able to get your approval on them. So we have a lot of work to do between now and then in order to find 5 candidates to bring to you. And right now, we have 2 vacancies. We have 3 anticipated retirements in January, and potentially another person or 2 that have indicated they may be resigning between now and then. From a retention standpoint, we're doing a lot of work to get our union contract resolved, and that is a really important thing that people are paying attention to within the walls of the police department more than they ever have before. We talked about pay and our comparable pay between our peer agencies, and we have some work to do there. So hopefully that union bargaining will result in better retention for us and better pay for our staff, and that's a really important thing. So just wanted to give you an update on that. We did have a really significant win, I think, in retention within the last couple of weeks. And, I think I mentioned in the last meeting we had a couple of officers that had applied over to the sheriff's office. One of our officers who's been with us for about 5 years had applied. He's a fantastic officer. He's one of our field trainers, and he's a military veteran. And so he has a lot of loyalty in him, and a lot of people within the department have talked to him about his decision to apply to the sheriff's office, and he notified us last week that he turned down their offer. He finished number 1 on their list, but he turned down their offer. So I'm really happy with that. Certainly he's a fantastic asset for the city of Wausau and the police department. So I would say that's a big win in terms of retention. So kind of on that line, I want to talk a little bit in this report about the great work that our staff have done over the last 3 months in this quarterly report. First, I'll say something that I didn't put in the quarterly report, but one of our parking control officers, Jim Hellrud, he'll be receiving a life-saving award at our city council meeting tomorrow evening. The last 2 awards that we presented here at the PFC have been suicidal individuals who have been on either bridges or ramps. And this is another situation where Jim was in the right place at the right time over at the Sears ramp, and there was a distraught woman on top of the ramp threatening suicide. When he got up to the top level, he actually saw her jump, but then realized that she was still holding on to the ledge by her hands, and he was able to grab her and hold her just long enough for somebody else to come and help lift her to safety. So just a fantastic effort on the part of Jim Hellrud. If you look at our community resource unit, they're always very active. We have, it's a popular assignment. A lot of officers enjoy working the drug investigation. So we always have really high performers in that unit. But if you look at, the results from the last quarter, we had zero fatal drug overdoses, to Mr. Graff's question earlier. We did have five overdoses that we responded to, but none of them were fatal. And I think, you can try to look for links in why that might be. And this is what I see in this report, and that is in July, our community resource unit investigated and arrested a heroin trafficker, and they took almost a quarter pound of heroin off the streets in that arrest, which is a really significant size of arrest. That person was a violent, non-compliant sex offender as well, and is in jail on a $75,000 cash bond. And so you think about how that impacts the life of people in our community, and you see that we didn't have any fatal drug overdoses in the last quarter from July through September. And all of the overdoses that we responded to were in September. So when we're able to make those types of large arrests of those traffickers, it impacts our community in a significant way. And that's our community resource unit working hard to rid our streets of those drugs. In addition to that, we had a significant marijuana arrest. There was this is a house that we received complaints on a lot from neighbors, and in our community resource unit and the joint task force at the county have been working on this place for a fair amount of time. And so it just so happened that they responded to what they thought was a car accident, like a motorcycle accident, right in the driveway of that place. And officers get there. One of our community resource officers knew the address and said, I should go over there and see what's going on. And so get there. There wasn't a crash there, but he could immediately smell marijuana, the smell of marijuana coming from the house. So just very good basic police work. Wrote a search warrant for the house, got the warrant from the judge, signed it, and went in, did a search warrant, and they found 2.5 pounds of marijuana and $43,000 in cash and 2 firearms. And they took all that stuff out of the house. In the basement was a 17-year-old's bedroom, over $10,000 in cash just in the 17-year-old's bedroom, and a pound of marijuana just in the 17-year-old's bedroom. So certainly think that was a significant supplier to the youth in our community. And another just really good basic police work, following the leads, following the evidence, and doing a really good job. So I just want to identify the work that they've done, and that doesn't even touch on the cases that they've worked on in terms of methamphetamine and the seizures they've made. So outstanding work by our community resource unit. Moving down to our investigations bureau, you see the third quarter convictions listed there on the left side of the 9th page. Henry West, he was found guilty of first-degree intentional homicide. That was the Pine Grove Cemetery shooting that happened in 2019. He received life without parole. 2 different individuals that were convicted and found guilty of sexual assault of a child that received significant prison terms, one of which was 25 years in prison. False imprisonment case where a person received 5 years in prison, and then guilty of homicide by intoxicated use of a firearm. That person received 8 years in prison. So significant cases that our team has worked over the last few years. They come to fruition. They take a long time to get through the court system, but we're able to get justice for the victims in our community. One other thing I'd like to touch on in terms of our investigative bureau, you see in that chart the major cases worked. The first one there says fraud, and it was a phishing attack on a local business where they lost almost $100,000 in that phishing attack. And one of the things that our detective bureau learned just through investigating, following up with the banking institutions, is that a lot of times in these phishing attacks, the money goes from one account to another, and that account that money goes to, it just kind of sits there. And if you are able to act in time, you're able to recover the funds out of that account. And so they were able to recover $60,000 in that of loss from that account just by working with the banking institutions, and again, just doing good police work. You see our victim resource unit there on page 11. That, if you remember, is Officer Sarah Bedish that works in that unit, along with Kristen and Lauren, our counselor, and our victim resource specialist. And you see that they've served several hundred people in the last quarter, a lot of domestic and family violence, child sexual assault, child physical abuse. Sarah Bedish wrote a search warrant just a couple of weeks ago. I went out with the unit in the execution of that search warrant, and that was just her developing a relationship and making the person that reported the information comfortable giving her information and trusting police. And so we were able to go into that house. There was a lot of drugs, firearms in that house. and we were able to get the kids into a safe environment, and that was really the priority for us in that case. So again, just good police work, building relationships, and making sure that we can keep kids safe in our community. Going down to the crisis assessment response team report, you'll see that the number of CART responses to calls for service is 133, and this is hopefully to give some context to the numbers here. You'll see that year to date we've had almost 400, which is already more than the crisis assessment response team has had in the last 2 years. So more calls for service that we've responded to, yet about half the number of commitments on emergency detentions. And that's exactly what we're trying to accomplish with that crisis assessment response team, and that is make sure that we are doing as much as we can to keep people out of the most significant and most restrictive care, which is getting committed to a mental health institution. So great work by our crisis assessment response team there. Our patrol bureau, they continue to be very short-staffed, working a lot of overtime. You'll see that in our overtime report, which I don't plan to touch on. But they're still working hard, lots of traffic stops, doing the self-initiated activity that is, basically the core work of our police officers. But a lot of calls for service that they're responding to, doing a lot of extra patrols and responding to calls for service. We have a little bit of a change to how we're reporting on our special events. You'll see that in here, and that is just to give our city council decision makers more information on how much we spend daily and monthly on those events. You'll see that we have identified how much it costs to have on-duty officers there, off-duty officers on overtime, community service officers, and then supervisors on scene for the variety of different events. And that doesn't even talk about our emergency police, which doesn't cost the city anything, but yet they give about 2,000 hours of service every single year to our community. And then the last thing I'll talk about is just the citizen complaints and internal investigations. We did have one that I identified in here. That same individual, so this individual wrote us a letter saying that he was arrested and the officers racially profiled him in the traffic stop, conducted an illegal search of him and the car, stole money from his wallet, and arrested him. So we did an investigation. The lieutenant that oversees those individuals watched body cam footage, read the reports, and determined that complaint to be unfounded. And that person is the one that wrote a letter to Mr. Harris, the president of the PFC. And so that is still pending. But I just wanted to make sure that you're aware that we've documented that, we've investigated that, and we've determined it to be unfounded. Happy to talk deeper into that if that's the will of the PFC in the future. So that's what I have for my report. I'm happy to take questions.
On page 4, that's the arrest by arrest dates from the FBI's reporting system,
Yes.
I'm assuming. And then if you look at that number, it's total for the quarter is 277. And then on our internal reporting, which is search warrant and arrest information, 2022 total year to date is 161. Is there a difference between how the FBI pulls arrest data than what we do? Or is that reporting something different?
So I see the 277. What's the other number you were looking at?
On page 7, it's search warrant and arrest information. It looks like an internal reporting.
Yeah, so that first page on page 4, that's the number that we report through all of the, every report an officer does, they have to list codes that get ultimately uploaded and sent to the FBI. That's where that number comes from. So that's a totality of the work that we do. On page 7, that's just the information that our community resource unit does. So that's one section of the reports that we write, is just the drug information that we do.
Got it.
Is that
Yeah, no, that
helpful?
answers it perfectly. And then, your overtime numbers year to date, you're pretty much on track to maybe meet or exceed the budget based on where you're at today.
Right.
I think your point is that at a policy level, whether or not we should continue to subsidize these events by providing their security. And I guess what do most communities do in that regard, or other departments of our size?
Yeah, well, it's all over the board. Some communities completely subsidize the safety planning of the events, and I think the fire department's in the same boat. They get requested a lot to have an ambulance on standby at these events, and, that's overtime cost, basically a straight overtime cost. And, to me, it doesn't matter to me what the city council decides and how they want to fund that. Just a matter of them making the decision, and if they want to bill for it, that's up to them, and, we'll fund it. We just need the overtime funding then if they're not going to bill for it. So, and I would say, just in regards to our total overtime budget, I don't think we're going to be over the overtime budget. Usually the first quarter is the most expensive quarter for us in overtime because we have our in-service, and a lot of that is overtime for our staff. So I project that we'll probably be underneath that number unless we have, some major incidents that we have to respond to in the last quarter. But the fact that we're over our budget through the first 3 quarters of the year is different than we've seen probably in the last 4 or 5 years. Usually we're about $100,000 under budget in overtime. So we've spent a lot of money in overtime this year, and I think that's just reflective of the staffing levels that we've had. Thank you.
All right. Thanks so much, Chief. All right. Next meeting will be scheduled for Monday, November 28th at 7:30 a.m. To have a discussion on the December meeting. Does anyone have an issue with moving the date to December 19th, moving it up a week? All right. If not, I'm not sure. Do we need to take a motion on it? Change the date, or are we good? Okay. All right, so then the December meeting will be on Monday, December 19th at 7:30. Other than that, I will entertain a motion to adjourn.
I'll make a motion to adjourn.
Is there a second? All those in favor?
Aye.
Aye. Motion passes. We are adjourned. Thank you.